David is sitting comfortably in the living room, reading a magazine. He suddenly looks up.
Emily, where are my glasses?
Emily walks in from the kitchen. She smiles warmly.
They're on your head, Dad.
David touches his head.
Oh, thank you.
Emily smiles and heads back to the kitchen. 3 or 4 seconds later,
Emily, where are my glasses?
Emily looks back. The glasses are still on his head. She gently points towards his head. David touches them again.
Oh, I forgot.
Emily gives him a reassuring smile and walks away. She has barely reached the kitchen when
Emily, have you seen my glasses?
Emily stops. She doesn't sigh. She doesn't roll her eyes. She simply stands there for a second. You can almost hear the question running through her mind.
What am I supposed to do?
If you have ever cared for someone with dementia, that sense probably feels very familiar. And if you are like most caregivers, one question keeps coming back. How can someone ask exactly the same question only a few seconds later? It's confusing because while you are talking, everything seems normal. They are listening, they are answering, they are part of the conversation. So, what's actually happening inside the brain? Let's take a minute to understand it. To understand the question, we need to understand something important about memory. Memory isn't a single ability, it's a process. When someone speaks to you, your brain doesn't instantly save those words forever. First, it receives the information, then it makes sense of it. Only after that does the brain begin converting that experience into a memory that can be accessed later. In many forms of dementia, especially Alzheimer's disease, one of the earliest areas affected is the brain's ability to form new memories. That means something interesting can happen. A person may hear your answer clearly. They may understand exactly what you said. They may even respond appropriately. The change becomes obvious only later, when the brain needs to use that same information again. That's why families often say, he was just told. And they are right, he was. The conversation happened, but understanding information and creating a memory from that information are not the same brain function. This is also why many people living with dementia can describe events from decades ago with incredible details, yet struggle with something that happens only a moment earlier. Creating new ones is often where the difficulty begins. And once you understand that difference, the repeated questions stop feeling like a choice. They start making clinical sense. Emily walks back to the kitchen. His glasses were still on his head.
Emily, have you seen my glasses?
Emily pauses. She sits beside him. This time she's clearly frustrated.
Dad, they're on your head. I've already shown you 3 times.
David looks at her. He seems confused, almost embarrassed. He slowly touches his head.
Oh, I'm sorry.
A few seconds pass. David begins looking around the room again.
Where are my glasses?
Emily looks down. She doesn't know what else to do. Did you notice something? Emily didn't raise her voice. She wasn't trying to be disrespectful. She simply expected David's brain to do something it could no longer do. That's the mistake almost every caregiver makes. Not because they don't care, but because it seems like the logical things to do. If someone forgets something, we naturally remind them. If they forgot again, we explain it again. If they still forget, we explain it louder or with more detail. The problem is more information doesn't solve a problem of memory formation. One of the most effective things you can do is surprisingly simple. Keep your answer short. Not because they can't understand a longer explanation, but because a longer explanation doesn't provide any extra benefit. Instead of saying that your glasses are in your head, remember, I already showed you a few minutes ago. Simply say, they're in your head, Dad, then help if needed. Short, calm, consistent every time. Another helpful approach is to rely less on memory altogether. Think about how often we use reminders in our own lives. We write appointment in a calendar, we set alarms on our phones, we leave notes on the refrigerator. We are not doing those things because we are failing. We are doing them because memory works better when it has support. The same idea applies here. If your loved one frequently asks where their wallet, glasses, or keys are, create one consistent place for those items. Use labels, large print signs, simple visual cues. The goal isn't to force the brain to remember. The goal is to make finding the answer easier. Sometimes the question isn't really about the glasses or the wallet or today's date. Sometimes the question is simply the way the brain expresses uncertainty. Think about it. If you couldn't hold on to a new information, the world would feel unpredictable. You might constantly wonder, did I miss something? Am I forgetting something important? Am I supposed to be somewhere? Those feelings often come out as repeated questions. So, instead of answering only the question, try responding to the emotion as well. For example, instead of saying, your glasses on your head, you might say, they are on your head, Dad. Don't worry, we will find them together. Or, I've got you, everything's okay. The words are different, but more importantly, the feeling is different. Sometimes reassurance lasts longer than information. One of the hardest parts of the dementia is that the disease changes the way the brain works, but it also asks families to change the way they communicate. That isn't easy. It takes patience, practice, and a lot of compassion. But understanding why a behavior happens is often the first step towards responding differently. I'm Hadi, a registered nurse. Thank you for spending these few minutes with me. If this video helps you better understand someone you love, I hope you will join me for the next one, where we will continue learning practical ways to make dementia care a little less overwhelming, one step at a time.